survey conducted by YouGov has found that 1/3 of Australians are concerned about either looking overweight or being overweight, looking overweight, or not feeling fit enough for the upcoming summer season. Bariatric, upper GI and general surgeon, Dr George Balalis joins me now. Hello, Doctor. Thank you so much for your time.
Not a problem. Thanks for having me.
So, are more people concerned about their weight than ever before, or is this just a standard figure and something that happens all the time?
No, I think that a lot more people are concerned about their weight. It's becoming a increasing problem in Australia as we really have an epidemic of obesity, and Australians are really struggling to get their health back and improve their weight and their long-term outcomes.
So it said that the survey states that only 27% of people who want to lose weight will consult a medical professional. Is that because the others will choose to try and figure it out themselves, or are they embarrassed? What would some of the reasons be because of that?
Yeah, I think there's a lot of reasons why people are not wanting to seek medical advice. I think historically medical doctors haven't been so good at managing patients' weight and being non-judgmental and providing patients with useful options for their health. So I think historically it's been a real difficult area for patients to get good advice from medical professionals, but I think that is changing. I run a multidisciplinary clinic in Adelaide, and I think it's really important to provide support for patients when they try and improve their health and get their weight down by providing all options available to them, including medication, non-surgical options, such as gastric balloons, as well as weight loss surgery.
Yeah, I'll ask you about the gastric balloons in a second, but it's as we've evolved as humans, weight loss really isn't one size fits all, is it?
Exactly right. It's definitely not one size fits all, and I think evolutionary changes have meant that the body protects weight. When you do become overweight or obese or morbidly obese, your body fights back when you try and lose weight, and that includes changing your hormonal levels of hunger hormones, as well as decreasing your metabolism, and that's been shown. And that's why patients really struggle to lose weight and keep it off. I think that's the issue, really. So
with things, George, like Ozempic and other drugs being available, have we become a nation of quick dieting fixes rather than eating healthy and aiming for long-term results, or is this the result of the body and the human changing? I think there's a lot of issues that are overlapping. I think absolutely our lifestyle has been more difficult than ever. We are working more inside. We are eating more and more processed food. We're also being more and more sedentary. And I think on top of that, there are the evolutionary changes which have meant that our body protects weight. And so I think all of those issues are coming to a head, and that's why we're really struggling with our weight as a society. So, George, have you seen an increase in people being much heavier than what they have been in previously? So, say, maybe 20 years ago, people might have only been
Absolutely.
20 kilos over. What sort of average are people overweight? What's the average weight? So majority of people in our society, so over 60% of our society are overweight or obese. So that is, quite a staggering figure. And Australia really is up there in regards to the rest of the world in regards to obesity. So I think we have a lot of work to do. And I think that medications such as what you've already discussed is one part of it, and there are many other parts to improving people's weight and health. Chatting to Dr George Balalis, Adelaide weight loss surgeon. You're also a general surgeon too. So what is this swallowable, if that's how you say it, gastric balloon, as opposed to not as is different to gastric banding, isn't it? Yeah, so look, gastric bands are out. Out of the over 20,000 weight loss operations performed in Australia, there were less than 250 gastric bands placed last year, and they're really from surgeons who don't perform other operations. The gastric balloon is a fantastic opportunity for patients to improve their weight and their health through a non-invasive technique. I was fortunate to be the first doctor in Australia to perform the swallowable gastric balloon, and have still performed the most procedures in Australia. And really, I find that it is a good opportunity for patients to improve their health in a non-surgical manner. It's 15 to 30 minutes. There's no anaesthetic. They can even drive themselves home. And really, it's about looking after the patient after the procedure. So that's where I think experience comes into it, and making sure that patients get a good outcome with dietetic support in a clinic that is patient orientated and has clinicians around to help that patient through changing their lifestyle and their routine.
So how long is it in your body before it disintegrates?
For 4 months. Over 4 months. Okay. Yeah.
And what's it made out of?
So it's a man-made polymer. It's not a silicone. Yeah. It's a man-made polymer. It's very soft. And really the complications are very low. So there's around a 3% risk of needing to have it removed before the 4-month time period. And apart from that, I haven't had any issues with the balloon to date, which has been good. But of course, there are risks, and we discuss that with the patient during the consultation. So
is there a requirement, George, that you still have to eat healthy? You can't eat the processed foods and the Uber Eats and all those kind of things?
Yeah, of course. Yeah. But the balloon provides an avenue for you to help reset your body, to not feel hungry when you're changing your routines, and to have the ability to decrease your portions and to eat healthily and liaise with a dietitian over that period of time. Okay. Yeah.
And would there be patients who aren't suited for this? Is it either heart patients or diabetic patients?
So BMI criteria is from 27 to 40, and then there are other criteria. So no previous open surgery is a big one, and there are other important factors that we need to discuss with the patient during a consultation. Yeah.
So, George, do patients need a referral to you, or can they just come?
Okay. As a specialist in the community, you need a referral from your GP, and then they can see us in the clinic, and then we can discuss more information in regards to risks and benefits for them, and to tailor an approach that's suited for them.
Well, it could be a way to go if you're not keen on putting medication or having it in your body.
Yeah. So, with medication, you really have to be committed to taking that for life. And that's fine. And I think that also provides another option for patients. But in our clinic, we are experienced in discussing all options for patients and with the most up-to-date information and evidence.
Is January the busiest time of the year for you?
Oh, look, it does seem to be that way, but I think we work very hard to make sure that we see patients in a timely manner, and I think it does seem to be a time of the year where people are really trying to be conscious about improving their routines, and I think that's just secondary to the good weather that we have in Australia, probably. Yeah. So.
All right. Well, it's interesting. So if people are interested, they'll just go to their doctor, say that they heard about the swallowable gastric balloon.
Gastric balloon, that's right.
And they get referred.
Yeah, absolutely. And they can find further information on the internet with our website as well.
Yeah, beautiful. All right. Thank you, Doctor. Appreciate your time.
Not a problem. Thanks for having me.
Take care. Dr. George Balalis, bariatric, upper GI and general surgeon.